Thank you, Chairman Buchanan, for hosting this hearing today. Healthcare costs continue to climb for Americans of all stripes. We've talked about that in various facets today. I know that both the majority and the minority agree on this, and there's sometimes a different approach to how to go about doing it. I'm here to offer and talk about what I think is a proven success story within the healthcare market, and hope to be able to dive into that. Right now, healthcare costs actually are outpacing inflation and GDP growth. Right now, 1 in 3 Americans cannot cover a $400 emergency expense with cash. Last week, I reintroduced, because we did it last Congress too, and we got some headway, and we've had some really great co-sponsorships on this, the Health Out-of-Pocket Expense Act, or HOPE Act. This would create tax advantage accounts to enable millions of Americans to save for healthcare costs through both individual and employer contributions. This would help working families to manage out-of-pocket costs and save for future medical care. Mrs. Strauss, thinking of the long-term implications if patients continue to forgo that care due to basic costs, what are those? How would you categorize those long-term implications, and how can healthcare dedicated savings vehicles like HSAs and HOPE accounts address this? And again, I bucket those two together. HSA accounts have proven to get broad support and have penetrated many different states, my state being one of them. HOPE accounts allow for individuals that are on regular premiums, that aren't high-cost, higher-income people, lower-income Americans, to be able to take advantage of this. Would you share a little bit how you feel how that would help?
Yeah, I think that, again, more options and just expanding the regulations around those HSA accounts are always going to have a positive impact. We talk a lot about education. When I sit down with my employer groups, I want to make sure employees know how to use all of the benefits that they have and the tools that they have. And so with the cooperation of employers, a lot of times employers want to contribute into the health savings accounts, which then actually incentivizes the employees to go ahead and participate as well. So those HSA accounts are huge benefits. Right now, they are regulated to a point that not everybody has access to them. So the expansion in the HOPE Act is exactly something that I think would be helpful for people. I think that it still takes education. It takes that opportunity for an employer and those independent agents like myself to make sure that people really understand what these benefits can do for them and how they can manage their health care and get ahead of these things versus waiting until there's already a problem. The way the health care costs are today, if we're not saving for that rainy day, we will not have the money to pay a $9,000 out-of-pocket maximum if we get hit with something catastrophic out of the blue.
HSAs have been applied to more high-deductible plans. Anytime in the policy-making world that you have a big idea, the fact that you've got years and years and years to look to typical HSAs and say, these have been successful, let's apply it to a new population of people. This will be applied to lower income individuals, people with regular premium plans, and this opens up something that we've already seen success. Apply it to a new population where I'm confident we'll continue to see that success. That's like a perfect storm for a policy aspect, and so we look forward to keep driving this forward. Thank you.
And I do think, I think that in those specific situations, that's a huge help because a lot of times that population can barely afford their portion of the insurance premiums. So they don't feel like they have the additional funds to put into an HSA. So that does open that up and give them that opportunity.
Thank you so much. Dr. Carlson, let me just throw out one quick stat. Diagnostic lab testing accounts for just 3% of spending, yet informs almost 70% of medical decisions. We held a hearing in Research Park at the University of Utah at a laboratory, a working lab. It was going on right behind us. Can you share how important clinical labs are to patient care, and can you expound upon the AI model that Mercy has used and how it's increased your ability to find diseases?
Thank you for the question. So diagnostic labs are a little bit different than screening labs, but yet they're extremely important. You know, that the screening labs is trying to cast a broad net. The diagnostic labs and procedures, because there's also imaging, breast MRI, for instance, that can help nail down a lot better, with better accuracy, what is going on. those are critical to the overall workflow and process. Again, what we've tried to do is to leverage some screening tools, and I'll use breast cancer as an example, that by taking a survey, one can really sort out whether they're at increased risk, that they would benefit from more than just a mammogram, but perhaps a breast MRI, also done on an annual basis, and that they have a lot greater sensitivity for picking up early breast cancers with that. So the combination of both the screening test and the diagnostic tests are extremely important.
Thank you, Dr. Carlson. I yield back.
Mr. Kosoff.